potential.
To cover.
We have a high population of those that actually can retire as well and take the subsidy. But it's
what they'd have to do is assume that everybody in county government retires at 55 or at 50, depending on which unit you're in, and then automatically goes over and takes takes advantage of this. And even then, I don't see how you get to $1,000,003. You said $181,000, and if we're limited to $16 per employee, that's correct, right? It never goes above. Well, $16 per employee per year, right, or per month?
Per month.
Oh, per month. Okay. Excuse me then.
And remember, in the assumptions that these valuations have, they assume that current participants at 65 are assumed to be married, and that all of these will elect coverage for their spouse in retirement, and husbands are assumed to be 3 years older than the wives, and they come...
Okay. I guess my feeling is that that's such an unreasonable expectation to put on our balance sheet to affect our bond rating. That if we have 28 people that are $16 a month, my feeling would be is just cease paying the $16 a month. I mean,
that's the smallest part, because that would be capped, and I think we could get by in doing a few other things with that. But the implicit rate subsidy, when you let them participate in our health care plan,
yes,
and the healthier, younger employees are subsidizing the rate that they would pay. See, if they had their own rate, they may have to pay several $100 more a month, and our current employees may pay a little less. So they do. If we separated that plan and quit paying the $16, then we would have no gas fee.
Can't we just quit paying the $16 and not change anything?
No.
Okay, well, that's my question. I must say I'm confused on this as to how we ever get to this $1,000,003. I mean, we have a composite rate that's a family rate, and then we have a double party and a single rate. And quite frankly, I don't think the young people on the married rate are subsidizing much of anybody. And as the older as you get to the two-party or even those that aren't taking it that are eligible for it. I mean, once the kids leave the house, I think your medical costs, prior to retirement, you're not really old, would drop considerably.
But that's not the assumptions that the actuary makes. They go in the worst case scenario and they come up with large dollar amounts that will fund it.
And we have the potential of 149 people that could retire and take that subsidy. And so it does. That's the bad thing about an actuarial, is that the way that it's put together, it puts out a very worst scenario. So that's why you need to look at, is it best for this county to continue with the pay as you go, and maybe get a new actuarial and take a look at new demographics and try to see, look at maybe some other options that we can do to maybe bring that liability down. Again, there's only 28 because most retirees can't really afford the health care. And I don't really, when we check with our health care provider, the thought is in some plans that when they're mixed in like that, the younger people are subsidizing it. In our plan, that's really not the case.
Yeah,
and the people that do take it are taking it because they may have existing health conditions and can't get on another plan of their own, and so they remain with the county and pay the high dollar because they wouldn't be able to get it in another situation. So I think those are some of the things that you have to balance out by just knocking those retirees out, what it may be. There are lots of other avenues, and I don't know.
Go ahead, Mike.
Madam Chair, members of the board, Mike Graves representing PARS. We are here today to listen to the board and help them study. PARS, as you well know, travels around the state of California working with counties helping them with the irrevocable trust. I just want to weigh in with this part of it. The board really has two separate discussions going on here today. One is, the first question becomes, and Supervisor Tryon was alluding to it, you have a separate question before the board, what do you do with your current retirees and that current makeup? How do you handle that ongoing fee of $16 a month and those 28 people? And do you establish some sort of policy direction as a board of supervisors? The second question is, how do you deal with Gadsby and the issue that's before you of $1.3 million of your actuarial? Supervisor Tryon, I mean, what they're doing here is using the worst case scenario. But Calaveras County is not alone on this. This thing runs from San Diego to Del Norte, all the way across the Central Valley. Every county is struggling with this. Your numbers are actually small. You have a small, confined group of 28 people that will ultimately get smaller. And you can deal with that group as you decide, which is one separate question. Do you continue to fund in that big swimming pool those folks that are there? And then secondarily, the other question, which is what we're here to help participate, and we'd like to be able to just hand out some additional information, do you pre-fund and do you set up an irrevocable trust that would then be removed perpetuity off of your books? So, Madam Chair, that question you had about putting bonds and stuff out is gone, because you have then, by the federal government standards, addressed their question as it regards to that. And it just removes it, because you've then, whether you fund it or not, it's actually an additional question. I mean, once you establish it, it's there, and you have revenue to fund it. But you still have got two separate questions. How do you deal with the question of the employees and that, and then do you establish an irrevocable trust? That's really what's before the board.
Well, I think establishing an irrevocable trust is one issue. Funding it is... It's
a separate question. Absolutely. But I just wanted to help clarify that.
Okay, thank you.
Thank you.
Supervisor Walensky.
I have a few questions on this as well. We have 28 people who have gotten on the status. During the time that those 28 people came on, how many folks retired and did not take that option?
Many, many more.
Well, do we have a ratio? I'm interested in sort of real life. I know the actuarials are going to set one benchmark way out there that is, if everything goes, in one direction and everybody takes the retirement and everybody is married and everybody goes the maximum number of years you can live, that sets one benchmark. We have a reality here, which is that 28 people in this exact situation, faced with the same choices other people will be facing, took this, and a whole bunch didn't. That gives us at least a new figure to think about as another benchmark. Now, here's another, and apparently we don't have that number before us, but if we did, it would help me sort of think about what middle grounds we might arrive at and feel safe. Another piece that's changing is that a lot of people who might have stayed on because they could not get coverage, that will not be the law anymore shortly. So there's going to be a whole different change in a different context, and we may have rural health care exchanges here, depending on elections and court things and all the rest of it. But if that takes place, that might very well change entirely, because certainly if I had a choice between something that was less expensive than, say, the Calaveras plan, and I was only going to get $16 for it anyway, I might very well go to something else. And I would guess a lot of other people would and already are. So I'm curious. I really want some hard numbers about our real-life experiences now, and then some guesstimates as to what's going to happen in relation to the new health care arrangements that are going to happen. It's only a short while before insurance companies can't turn you down. So that's for pre-existing conditions.
I don't have some of the numbers you're asking for, but at the most, in the last 12 years, there have been 35 people at the most. So 35, 33, 28, 26, never been above 35. I need to get you the ratio of how many actually go out the door and are offered it as opposed to that, but those numbers are large.
Well, when we look at 149 as the potential, it'd be nice to take a percentage of that based on sort of maximum experience in the past, and then factor in what we think might be the new arrangement and how that might affect it. That said, I'm curious also, there are a number of counties that have been referenced, but it's not clear which ones of those took partial or full amortization, what their liabilities were. Most counties that are in trouble took more than $16 into this system. San Diego is a good example of people who took a high risk in a more optimistic economic context. We did not.
Right, the ones that I mentioned are the ones that did what I was proposing, and that they created a separate rate or separate pool for the retirees, so there was no subsidy in the rate.
Okay.
And to me, that's just the simplest issue at hand. If you decide then that you want to provide a benefit, then we could also do more research into the HSAs, etc.
All right, and my last question is, since this is a commitment that may have been made under some contractual obligations, doesn't this involve some form of discussions with representative organizations?
It does, yes.
I'd be curious what they think about it.
If we were to take away.
Yeah.
Oh, yeah.
I'm taking a guess, right? But I'm just like to hear from people about that before making any kind of directives here.
Well, let me go back to my question, which is kind of a follow-on to what Steve's talking about. I'm still puzzled at these numbers. I mean, if you're saying that we put $181,000 away as a one-year accrued liability, and $16 a month is $192 per employee per year, then you're saying for 1 year we just put money away for 900 people, plus or minus. And, we got 28. It fluctuates between 25 and 35. I mean, that's so far beyond the pall. I don't know how we in good conscience can say, well, let's fund this on the basis of $900 a month, and we're going to commit all this financial resources, $1.3 million, to put in this irrevocable trust, when our history is 25 to 35, and I mean that's just a huge amount of money we're going to commit for. I don't quite see what good point. Let me just finish the thought, I think somebody said, oh, well, you just keep paying it. But my understanding is this ends, the $16 a month ends at 65. That's when you go on Medicare. So it ends at 65. So what we have is basically a 10-year window maximum, because you can't, if you're one unit, you can't retire before 55, and it ends at 65. And then there's the other unit that can retire at 50 and then would end at 65. So you're talking a 15-year window for a very small group of county employees and a 10-year window for a maximum amount of county employees. I mean, I would personally, unless somebody can show me where we actually might in any way approach these numbers in liabilities, I think we would be taking a huge amount of money. Right now we're paying what is it, $7,000 a year. Well, if you use the 5% and said, well, what's the principal balance to cover $7,000 a year with a 5% rate of return? It's $140,000. It's not $1.3 million or $1.4 million, and I just don't know, particularly, I mean, right now I'm for just continuing paying the $7,000 a year. I'm sure not for running out and funding $1.3 million, in our financial condition, but I would have a hard time unless somebody can show me that there's some reasonable expectation that this liability will ever approach anywhere near these numbers. I would have a hard time saying that we're supposed to commit, $1.3 million to cover a $7,000 a year obligation, or $8,000, or I mean, it may go up a little bit, but I mean, that's a long way from $1.3 million or $1.4 million, in my opinion. So anyway, unless I'm not reading this right, I'm looking at these numbers thinking, my God.
There was a lot of consternation on GASB, and I was really surprised when this one aspect did pass that was included with the gas fee 45. At one point, I thought this one section was dead. There was only one person on the gas fee board that thought this should be included. And I thought, it will never pass. And then, it goes out to, everyone, or, entities throughout the United States and then, and Canada, no, just the United States. And that's UFOing. And I think they got enough comments back on the concern on the rate subsidy that, the one person won out that was on the board, and it's in there. I was shocked, and it's still in total disagreement. For such a small amount of money, our financial statements could take a huge hit, by the time we finish our accrual. The 1.3 million is a lot of money.
Plus, there's a lot of changes coming as well. So, with the economy, the health reform changes, knowing that we're pretty consistent, we stay in a very affordable range right now with what we're doing. Those are all things that you have to consider on how you want to move forward.
Didn't the DSA have a health bank?
They have a health trust.
Trust.
Yes, they do.
So are they part of the 28?
Of retirees?
Yeah.
I don't think
Or they could be, because they went.
I don't think any of them participate in our health plan, but I don't know it for certain. I want to get accurate information. They have the ability to stay with our health plan. Their trust actually gives them extra money from the health savings account. That money's put in there monthly, and they can use it for whatever they want. It offsets a premium, to pay for, prescriptions, to pay for anything that they need.
Okay.
So they can still get the $16 a month subsidy as well, if they choose to remain on the county's plan.
Do any of the other supervisors have any comments they'd like to make? Okay. I'm somewhat in agreement with Tom. I would... What?
So you're never completely in agreement.
Somewhat. Somewhat.
I mean, I think we have...
Somewhat's a good day.
That's a good thing. You're right.
I think we do have an outstanding liability on the part of the county. I guess I'd like to see us make that up over a period of time. I'd like to also see us get out of this and have us negotiate how to do that. I don't think for the people that we're serving and the exposure to all the other county departments, I think is significant. And putting in a irrevocable trust, I don't have a problem with that. We have some of those. Designated fund, right?
Yeah.
I mean, what's our exposure? And the exposure is something that we could probably absorb if we had to absorb it.
So are you
versus
asking-
building up, putting in $100 and whatever it was, $140,000.
I think your
can't do that.
exposure would be so low if you did stopped at $16 a month and you had the retirees their own rate, and if you left the current ones in the plan, then that would be capped, and we wouldn't need irrevocable trust and all of that. Because you usually continue to pay as you go.
But didn't I understand you to say that if we had one, that would help with our bond rating? We're, outside of doing some trans, we're really not, of course, who knows where we'll be in 5 years or 10 years.
But if you didn't have those large benefits payable, you wouldn't need. See, if we only had those few people in the trust that are going to be here the remaining 10, 15 years, whatever it is, it's already been 2 years since this valuation. So now say we're down, we might only have to accrue, say, $10,000 or $20,000 a year for 5 years. And we've already accrued $181,000. So we might actually get to write off some next year. So if you have a very limited amount of people, the dollar amount would almost become insignificant.
I know, the dollar amount is, on 7,000 years, insignificant. And to say that we're supposed to dig up $1.3 million for an irrevocable trust is just an absurdity. I mean, even in good times, in my opinion, that would be an absurdity, let alone the times we're in now.
Jeannie, do you have any thoughts on this?
I think you ought to continue paying as you go, and if you want to set up an irrevocable trust to show that you acknowledge that you have a future liability, and then as times get better, put a few dollars away. You don't have to fund the trust right now.
You can fund it when times are better, and I mentioned that. And you can fund it at levels that address what we're actually paying. You can put in the trust so that you're working towards, those future benefits.
Do you all want to voice your correction?
I like what I heard Jeannie say, that it's kind of a hybrid, to continue to pay as you go and also set up that trust account. So we would have to have funds to set up a trust account.
We have them.
If you don't have to put any money in it.
Well, I have a couple questions.
Yeah.
The current 7,000 or 6,000, whatever it is that we pay yearly, is that a lump sum that goes into a pool now, or we just pay a monthly based on the 2816? So if we took 7,000 to put into this thing as a lump sum at the beginning of the year to fund, would that qualify as a starting as yes? Because I'm looking at some numbers. I just ran some numbers, and you said there was 149 people that could retire, and 28 that are at $16 a month. That's a yearly figure of about $34,000 that I came up with. And in the 5 years, I guess not including 2010, but from 2004 forward, I came up to about 179,000, somewhere in that figure, which is close to the 183 or whatever. I guess there's some more figures in the book that give you that quotient. So to me, it is pretty close. And then I'm figuring if they're going times 10, that's how they're getting to the 1.3 million, is how they're getting the quotient to it. That's the number, Tom, how they got to that number. So that would be over a 10-year period, and that's the liability that they're saying we have on the people that haven't retired yet, plus the people that have retired. And that number could probably change at any time. It could go up higher and it could go down lower, so some of that factor is probably figured into all of this. Yeah. So I'm leaning towards pay as you go, but I would like to see a trust fund. If we have at budget time $7,000 and put the lump sum $7,000 into that pool and at least get that started, we could show progress towards it. I think, and it would probably work. Yeah,
It acknowledges.
I mean, to me that makes sense. So that's my direction.
Linda, how do you? Sounds like.
Well, since it's such a small amount, I would still prefer to remove it and do something where we didn't have to have the irrevocable trust and still accruing. If we don't have a separate rate, we still have to accrue the 1.3 million. And if you decide or they require us to start funding in the future, it will have to be set aside. It just makes, to me, it makes more financial sense to stop what we're doing and do something better for employees. And
I don't know that it's better.
instead of putting it into an irrevocable trust, I would rather see them in savings accounts or something that they can take with them when they move and use the money somewhere else, something like the DSA is doing, something like that.
So that would mean opening up discussions with the employee groups.
Well, that could be part of the negotiations, or it could be, I don't, as far as I know, I don't recall a formal agreement with the retirees. Was there?
It's part of their employment when we had our health care that the county would pay that.
Wasn't it a requirement, though, of the healthcare system we had at the time?
It was, and then when we
It was a
moved over,
requirement of the system. It wasn't that we sort of offered it. That was required, given the healthcare system we had at the
And we were
time.
with CalPERS. That
Yeah.
amount is over $100 now. When we
Okay.
moved to EIA Health, we kept the existing plan that we had and moved over.
Okay.
I think there's lots of things to think about if the board wants to change that for employees. We need to talk to the bargaining groups, and we need to make sure, I know our health plan provider can rate them separately, but we would need to have that done during the plan year, which would be January, and we would have to give those 28 people the ability to notice on whether, they could stay in the plan rated differently at a higher rate and be able to get on to another plan. I mean, you need to be fair to those people that have been taking it as well.
Well, can't they stay on the same plan, just pay $16 a month more?
They can, but I wouldn't want to just do it overnight.
Right.
They would have to be rated as part of the plan year during open enrollment, which happens in October, and rates change in January. We can get started on that work. But you also need to be fair to those people and
No, that's
give them
right.
adequate time to have the factual information, understand what it's going to mean to them, what the rates are going to be, so they can make decisions to have health care. All health care reforms going on at the same time as well.
Okay.
Well, I feel an obligation to those people we've made a commitment to. But if you change the rate for them from 16 to 100 or 50 or whatever, isn't that changing the conditions?
The $16 is the subsidy the county pays for
Right.
them. They pay the rest of the premium now as it is. We just contribute. That's what the county contributes towards their retiree health care. They're still paying the bulk of the premium. What Linda's suggesting is we no longer pay that, and we rate them separately so that they are paying at a retiree level, which is a higher amount of a premium for them.
Yes, but
And what we get in this pooled system currently.
can we separate the 28 that are currently being receiving from everybody else and say we're not going to continue with everybody else, so we can just address the 28?
Yes.
Okay. That's what I think we should do.
And not set up the trust designated fund.
And this would be different than a designated fund because it would be like CalPERS, you would set it up
Right.
with PARS or CalPERS or one of those. So
Steve, do you have any?
I think we're having this kind of surface conversation about people's benefits that we committed to, and I find I'm very uncomfortable in this kind of discussion until we have the appropriate, under Myers-Milius-Brown, the appropriate conversations with the exclusive representatives. And I hate to keep raising this kind of thing, but I find this to be troublesome in relation to very difficult negotiations we've got right now. We're going to try to dump this on too. I feel kind of bad for our negotiators as it is. I think that we have two different kinds of issues going on. One is how we're going to deal with an actuarial report and how we want to respond to it, and we have several different contexts. We have, in addition to that, many options that Linda laid out, and I think that those are worth studying, but I don't see any reason that we would make decisions today. I think we've got discussions to have with employees. We have research to do. And I'd add one other thing, which is that I'm curious, given the report that we got, what kind of, with so many wild card variables, there are at least some things we do know that are not in evidence right now today that I would like to know before making any kind of choice about what directions we're asking staff to, what trees we're asking people to bark up. I think we need to know a lot more about what's in those trees, and I'd sure not like to I don't feel comfortable with what we've got here. One example is here, It says that we might have, under certain circumstances, to pay, we have unfunded liabilities that we need to pay. I like to plan ahead. I like to know what's a reasonable amount to put away and what that will offset in the way of costs. But I don't know that, and I have no good guesstimate right now. I don't know the percentage of people that retire that take this in the current situation, and I won't know until a year or two from now how many people are going to take that option under new circumstances where insurance companies can no longer turn you down for pre-existing conditions. So with all of that out there, why would we be making a decision that would get us into kind of an argument with people that we don't really have a reason to have an argument with right now?
That's one option, is to continue the pay as you go indefinitely and keep approving the financial statement.
I think Gary's
For a little
suggestion
while.
was a good start.
Yes,
And then we
I
can
think
come
that's-
back to you and actually give you options
Right.
of the different companies that have the trust.
For this year,
We can provide information to you, we can get you the other data. In the meantime, we can get a new actuarial, our demographics have changed the last
idea.
couple of years since we had this, and you can review it again. I think the board has pretty much said that you want to continue with the pay-as-you-go. You want to set up a trust. You want to start off by, putting into that trust the minimum sort of amount that we currently do, and then we can constantly review it. Because it does also require that you do an actuarial every 2 years. And then a lot is changing as well. And so I think that is a good way to go if you are concerned about the bond and you want to address GASB 45, but at a reasonable level.
And I think you said the same thing Steve did. You don't want to do anything with the employees without discussing it with them.
Right.
So we have to.
Okay. Are there any?
It's not an option.
Are there any other comments from the board? Does anyone in the public have anything they'd like to say on this?
Shaylin Stratton, Mountain Ranch. I just have 2 comments. One, it's my understanding that if you do an irrevocable trust, then you are going to have to report the unfunded total as a liability against the county budget. So whatever that actuary comes up with, whether it's the one you have now or the one that we have 2 years from now, unless the board comes up with the money as a lump sum, it's going to continue to show as an unfunded liability, and that will hurt our bond ratings, and that will hurt our trans and so forth. So that was the first thing. My understanding, I want to make sure was correct. And secondly, if I were a retiree, I'd be very uncomfortable right now, because it sounds like that what our Supervisor Tryon was suggesting was that you peel those 28 people off and reschedule them based on their existing conditions and so forth, which is going to significantly increase their premiums. Mm-hmm. And if I retired thinking I would have the opportunity to pay my medical premiums based on a group rate that does reduce the premiums because it is a group rate for the entire county, to suddenly have those rates doubled or tripled, which is entirely possible, I think would be very, very disconcerting. And in fact, could put them in a position where they would end up with no medical at all. So those are my 2 concerns.
Very valid, Jay. Thank you. Okay. Is there any further discussions needed on this? Okay, thank you very much.
So what's our,
We'll set up the irrevocable trust and put the 70,000 in it. We wish I would show you.
Well, prelude to budget. Okay, this is the time where The board looks at the master fee schedule once a year. Doesn't mean there'll be any decisions per se made, but there could be direction given. Shirley, are you going to take the lead on this?
I will, at least initially. As you mentioned, Supervisor Callaway, according to our normal process as part of the proposed budget, we send out the master fee schedule to all departments for their review, and we request that they return to us any proposed new fees, deletions of current fees, or revisions to current fees. We put those changes, revisions, new fees into a schedule for the board's review, which is what you have in front of you today. I just passed out a revised fee schedule. It included a number of fees that were not initially included with your board packet. We highlighted those in yellow on the fee schedule so you could easily pick those out. We will follow the board's direction given at the end of the study session and return to the board with any changes that you wish to see in the fee schedules and have those adopted by resolution within a few weeks. And then those fees will become effective 30 days after that. Department heads who have worked on their fee schedules are here to answer any specific questions regarding the proposed changes or additions to the fees.
Okay. Well, why don't we do the easier ones first? That's the building department? No. Those fees that the board has no control over, that are established by government codes or statute, so we can look at those. I'll let the respective departments, or Shirley, did you want to take that?
The fees, again, within the departments know best what their fees are and what are governed by statute or government code, so that those fees to them. So what we're trying to do is have a comprehensive master fee schedule. And so when we are adding or changing something to that fee schedule, we like to bring it to the board as part of this. But there may be fees on here that the board really does have no control over because they are set in government code or statute.
Right, so why don't we let the clerk recorder go, since most of those seem to be established.
Right. All of the fees that are all of these fees that are changing are not actually proposed changes. They are statutorily set fees. So they've just changed since the last fee schedule was adopted. I don't really have anything else to say.
Okay, so what you're saying, Karen, is that the board has no say on these fees. These are statutes.
The board has no real authority over the fees at all, no.
Including the fish and game ones that go...
Right, those are not even that's not even county money. Those things that have changed are not even county money. That's state money that we collect, and then we forward on to the state. So it's not even...
Well, do we collect it from our citizens, or do we get it from the state?
No, we collect that from they're collected from environmental impact report filings. So when those are filed, we collect that from the individuals.
Okay, and the state sets the amount of the fee?
Yes, Fish and Game Code, yeah.
Wow, okay.
Okay.
So,
Karen, there's really no approval needed by the board. These just happen to be on the master fee schedule, so everybody knows what the fees are.
Correct.
In Calaveras County.
Correct. I did have a specific question asked of me about the recording fees, because the recording fees are set, the base recording fee is set by the government code, and that has been set at the same amount since 1985, and it changed this year to the base recording fee has changed, and that's what created the change in that recording fee. There are other fees that encompass that $15, but the base fee is what increased, which is set by the statute, if that makes sense.
Okay, are there any questions of Karen, on clerk recorder fees, we have no say on these.
My only question would be to the state, because I don't feel that the dollar for dollar and pound for pound, we're getting our money's worth off of this kind of stuff. Every time we have a state fee increase to 80% higher than before, I understand some of these are really old, but some of these things are, you look at some of these notices. I'd just sure like to see the state have to justify as much as we do the nexus between the charge and the actual cost of the service, because some of this does look kind of out there.
Like what? Just, I'm just curious. So I might be able to answer something.
The Fish and Game going from 13 to am I reading this? Well, no, that's 14, excuse me, $1,250 to $2,792.25. It'd be hard for me to imagine in the last couple of years, that the cost of providing that service could have gone up that much.
Right. That one I really can't speak to, so, yeah.
Nothing we can do anyway, so.
So, Karen, just kind of curious, file but not required to be recorded?
Yeah.
Why would people file things with you if they don't want it recorded?
Well, there's a difference in being recorded. Actually, when you record a document, it becomes an official record, and forever and ever. And that's things like our land transactions and those kinds of things. It's a difference. Then filing is just a document that I'd file, like some maps are filed, and there's several different documents that are actually required to be filed in our office but not recorded, which is where they get an official number and, like your deeds and those kinds of things.
Okay.
I don't know how to explain it any other way.
No, that's fine. So if there's no questions, there's no action on the board's part, just information. Thank you. Okay. Probation.
Good afternoon, Terry Hall. We are in the process of upgrading our electronic monitoring from what we can call an old-fashioned monitoring system up to GPS. And so that cost, we're actually going to be hopefully imposing that in the next couple of weeks. The cost of the monitoring is going to go up from $2.25 per day to $2.25 per day per unit to up to $7.50 per day per unit. So we are asking that the offender be instructed to pay $20 per day per GPS instead of the $15 to cover the increase in the GPS equipment.
And that is my choice from all of these as the easiest one to say yes to.
It's under the penal code. This is a choice for your department to go from 15 to 20?
Yes, the penal code section it explains what electronic monitoring is, and the county can set it per jurisdiction. And right now, the trend in the state is GPS, and that is the actual cost that other counties are charging.
So will you be subsidizing GPS with the additional $5? I'm not real clear.
I'm not sure what you're asking.
Well, you're going from 15 to 20 because you're going to a GPS system. So
yes,
I'm trying to understand what the funds are going to be used for.
Well, because of the increase in the actual rental or the lease of the equipment, we're asking to increase the fees per offender per day. Right now, the way it's set up with the penal code, the offender is only required to pay based on their ability to pay. So we do not see too much revenue from this at this point. So we're hoping that will change with the upcoming months. We have some things we're going to be presenting to the board.
Terry, if somebody can't afford it, but you think they're a good candidate, do you still do it?
Yes, definitely.
And then how do you pay for that?
Well, we have a fund that
general fund.
We have general fund, the good old general fund that we tap into, and we have funds available there for that.
Okay. Thank you. Do any of the supervisors have questions of Terry on this? And what is your thoughts? Yes, no?
Yes.
Steve's a yes. Tom?
Yes.
4 yeses.
Thank you.
You're welcome. Okay, Ag Department.
Two truly exciting fees for you today. The first one is an exam fee for structural pest control operator. Currently, anyone that works for a business like Clark Pest Control or Foothill Pest Control, they need to take a license exam. And they can go to Sacramento and take the exam, and it costs $15. I would like to establish this fee and enter into an MOU with the Structural Pest Control Board so that we can administer these exams here locally and provide a service to those pest control operators. And it's written into the MOU that the cost of that examination fee is $15.
Is that what they're paying if they go to Sacramento?
Yes.
Mary, if someone like Clark or Safeguard or whoever operates multi-county, how does this work? You're going to be doing it, testing on behalf of 2 counties or 3 counties?
Well, currently Tuolumne County also administers the exams. And we did have a call this winter for someone asking if they could come into Calaveras County because they were local. But I think San Joaquin County will administer the exams, Sacramento at headquarters, and I would just like to provide it as a service to our local industry. So someone from Amador County, yes, could come to Calaveras County and take the test. Someone from Tuolumne could come to us and take the test.
And they only need to take it in one location. Once they're
Absolutely.
licensed, they're licensed.
Yes. Yeah. It's a state license.
Okay. And it is the same fee wherever they go?
That's right.
Okay, thank you.
Okay.
Are there any questions? And the exam fee for service agents?
Okay, again, this is written into statute. The fee is $35. A service agent is a person that works for a service agency, and that means they repair weighing and measuring devices. And every 5 years, these individuals have to take a written examination, and the fee for that examination is $35. They can go to the county ag department to take it, or they can go to the Division of Measurement Standards and take that exam. We have been administering this exam since 2001, but it has not been formally established in the resolution for these fees, so I'm bringing it forward to get it memorialized here.
Have you been charging $35 for it?
Yes, we have been.
Okay, so all this is doing is, if this is the same fee under the code,
yes,
wherever they went, they would be paying the same, and you've been doing it and charging?
Yes.
Okay. Tom?
Yes.
Steve?
Yes.
Russ?
Yes.
4 yeses. Thank you. Treasurer tax collector. Ms. Norfolk, we've seen you a lot today.
3 times today at least. Okay, these are not new fees. We've been charging them forever and always.
You've been charging them what?
We've been, well, forever and always. It's a new term. We've been charging them forever. The business license late fee is in ordinance. It's just never been apparently on the master fee schedule. Certified mail fees, well, right now, that's what we have to recover and charge back is what it costs us. You know, that could change tomorrow, you know, things of that nature.
But these aren't really new fees.
None of them.
These are in existence.
Okay,
They've just never been on the
That's
master
right.
schedule.
Or they're a result of what Karen spoke about in the clerk recorders, $12 as opposed to $11 for a release. We're affected by those as well. So no, these are not new. They're just being added to the master fee schedule.
Okay. And these are fees that the board has no control over? And with the exception of the license late fee that's in our
Yes, if the
local
ordinance, that's right, if the ordinance, business license ordinance was changed, you would definitely have some.
Okay. All the others, though, are set by statute?
R&T code or statutes from other departments, like recorder.
All right. Board? Steve,
Yes.
start with you. I got one
Yes.
yes. Russ?
I'd like to get a clarification on what this research fee is about, the public auction fee.
And when I say contract, that's the current contract that we have for doing our research to come up with the parties of interest. We have an individual that is under current contract. That's what his charge is. Once that property sells or is redeemed, we pay him that $200. But that is a fee that we are charging and have been charging for several years.
Okay. All right, I'm a yes.
Okay, board.
Thanks.
Why don't we, Jeff, I'm saving you for last in case you're wondering. Thank you.
Special treatment.
Yeah. Why don't we do public health, the HIV test?
Calling Tracy Health Services. Unfortunately, our state funding supporting HIV testing was completely eliminated 2 years ago. In response to that, we were backfilling with realignment revenue. It's what we're attempting to do is, this would be an ability to pay, as all of our clinical service fees are, is for those individuals who can afford to pay all or part of this to help defray the cost of HIV testing. In addition, what it does is it positions the department for future third-party billing should we expand our scope of services to include family planning. In Tuolumne and Amador counties, the primary way you can receive an HIV test is through family planning services at this time. So we decided to calculate our direct cost for supplies and nursing personnel and put forward a fee at this time.
Go ahead, Steve.
I wanted to try to figure out, generally speaking, on something of this nature, early detection is absolutely essential, and the costs of that, both for the individual but also the community at large. So I want to make sure that we're not sort of giving any kind of barrier at all to people coming in. I know that we'll do this if people say they can't pay, but what if somebody said, well, it's $19 and they know it's $19 and don't come in as a result? Is that possible under this arrangement? Do you see because even if there was one person in the time that this happened who was positive and was still out there in the community not knowing the result, that would more than offset any savings of $19 accrual for this. And I'm a little leery about this. I just want to get reassured. I trust you implicitly, but
it's similar to what we do when we established our procedure fees for administration of vaccine. You don't want to create a perceived barrier that somebody then chooses not to act upon as a result. And so in all of our outreach, at all of our clinics, we prominently, nobody is turned away for inability to pay. And I would be doing the same thing with regard to an HIV test. In Calaveras County, we don't have a lot of demand for HIV testing at this time. We have worked hard in working with organizations that serve at-risk individuals, Sierra Hope, Substance Abuse and Behavioral Health, to try and increase the number of persons who are seeking HIV testing appropriately because of your risk profile. So I think in continuing to work with those venues also in terms of, in a sense, case finding to refer people to testing, we would continue to assure that they understood that cost is not a barrier. There are county health departments now, much to my professional dismay, who don't offer HIV testing.
have you ever met anybody too proud to take that? We would turn
Absolutely.
away as a,
Yes.
rather than
Yes,
take
at our
the
annual
subsidy?
flu clinics every year, we have people who, we have to be very careful about how the staff present the concept of a fee versus a donation, which is what we had before, okay, was a donation concept. And people who insist on contributing to the cost of their care. We spend a lot of time role-playing and staff training on how to present information related to requesting funds from the public. So I am very sensitive to the concern. It was not a straightforward decision or an easy decision to say we were going to attempt to defray cost. Just as importantly, though, just as it was with the vaccine administration fee, we can't bill a third party. You can't bill Medi-Cal if you don't have an established fee structure. So part of it is really creating the administrative infrastructure necessary to allow us to realize third-party revenues associated with those persons who do have coverage. Yeah, it's a tough, yeah.
Why is this so much more than the flu shots and the donations we were giving for those?
Well,
is it
it's not that much different. I think our current fee for influenza vaccine administration is $16. This involves drawing a blood sample, so it takes more staff time and has more supplies. We have not included, we have a contract with San Joaquin County for public health lab services, and we have not included a component of cost for that in this. So we've really kept it to very much the nursing time and the direct supplies, but it does take time. It also takes time to do an assessment of risk, and while we've certainly for persons who don't have significant risk factors, minimize the amount of nursing staff time being spent on education and counseling. For persons that do have significant risk factors, we have a not insignificant amount of staff time that is spent in reviewing what those risk factors are and how they can reduce their risk if they're not infected, of becoming infected, and if they were infected, their risk of transmitting the virus to sex partners.
Are there any questions, comments? Board's position?
Yes.
I'm going to be no on this. I'm sorry.
Wes?
Yes.
Yes. 3101311. And Colleen, the understanding is it's still, if you can't pay, you still get it.
All the clinical service fees and public health.
Okay. Thank you. Okay, let's go to environmental health.
Good afternoon, Brian Moss, Environmental Management, Environmental Health. Today before you, you have 5 new fees that are proposed. This is through the California Health and Safety Code. Part of this actually is new definitions under the Health and Safety Code. The food facility now includes something called a restricted food service facilities. That includes ag homestays and bed and breakfasts. In the old days, we just had bed and breakfast. So what we've done is we've coupled bed and breakfast with ag and homestays. The Health and Safety Code defines agricultural homestays as well as bed and breakfasts. So essentially that's an existing fee from the bed and breakfast standpoint, and it's new for
Brian, I have to
homestays.
say I'm lost. Where I'm looking, were you talking about licensed healthcare facilities? It now includes homestay?
Excuse me. Why am I not showing restricted on this? Prepackaged only farm stands. For some reason, I'm not showing it. Let me take a look at my schedule here as well. You don't have that on your schedule, so let's go ahead and ignore that. For some reason, that didn't make it on this. I apologize.
Is it your intent to have it on there?
It was my intent to have it on there, correct. It was a new fee. Actually, bed and breakfast is an existing fee, and what we've done is we've put in restricted food facility as a definition, which is what I was describing just now. I apologize. I was going off my fee schedule. It doesn't change as far as the fee is concerned. The fee is $178. That doesn't change, but what we've done is we've cleaned up a little bit of language pursuant to the Health and Safety Code. We've also done that with a couple of other food items as well. One is restaurant greater than 375 square feet, and one is another restaurant with bar additional. What we've done is we've changed it to food facility rather than restaurant. So there's just some nomenclature issues that we've taken care of and a cleanup there. So one of the reasons that's probably not shown on your schedule is because it's not actually a new fee.
So the fee is remaining the same?
It is. It is for that. That's absolutely correct.
Okay, and you're adding restricted.
Correct. Restricted food facility pursuant to the Health and Safety Code. My apologies. I didn't notice it wasn't on the schedule.
And that is the same. That's 178?
That's 178.
And so where was it, how did you account for it before? Did you account before under restaurants?
Bed and breakfast.
Under bed and breakfast?
Correct. That's correct. So it will now say bed and breakfast / restricted food facility is what it will say.
And you have been charging 178 on
Correct.
that?
Correct.
So all you're doing is changing the nomenclature
Correct.
on that?
On that one, we're just changing nomenclature.
Okay.
That is correct. And I apologize again.
Just a question. Surely that's not
We'll change that.
Okay, that's fine. So that's not on for any action.
There's a couple of other items that are here for nomenclature as well that I will give to Shirley with no changes of fees at all. Okay?
Thank you.
And back to what you actually have before you. So we'll start with licensed healthcare facility. That is now considered a food facility under the term food facility under the Health and Safety Code. In addition to that, what we just talked about, restricted food service facilities. So that means essentially, like, as an example, a hospital. Inspecting the kitchens at a hospital, where the Health and Safety Code wouldn't have captured that before. Our authority has broadened pursuant to health and safety is what that comes down to.
But the fee isn't new. I mean, you've already been
Actually, no,
inspecting.
that's new. We have not. This is a brand new fee because we have not been inspecting licensed healthcare facilities. So that is a new fee.
I mean, you don't inspect like Foothill and all
We hadn't in the past. The Health and Safety Code now gives us authority to do that.
So who inspected?
I want to say the State Department of Social Services who actually licenses those facilities.
So why would we want to take it on ourselves to do that if they're doing it?
It was actually changed in the Health and Safety Code in what is now called Cal Code, which is the food code for California. And it falls to local health jurisdictions.
I guess I'm saying if we never inspected them before because it was done by the state, why are we taking it on ourselves to do it now? Why not just leave it with the state?
Essentially, what the state has done is they've passed the authority and the program down to us. Now, as far as I can't tell you how often the state was actually inspecting these facilities, it is our practice for all food facilities to go in and inspect them at least annually, if not more, depending on what we find. So to answer your question is, from a statutory standpoint, it was passed down to local health departments and local environmental health departments through statute and adoption health and safety, which was once carried out by the state.
So they're giving us the work to do.
That is correct.
That's the question.
And where it says 267 and 50% of fee, What are you saying?
That's a late fee, 50% of fee. Generally, I wouldn't expect a licensed healthcare facility to be an issue with this. This fee actually takes effect more for some other smaller facilities.
Okay, so this is what the state was doing. Now the work is now with you.
That is correct. In addition to food facility definition, farm stands are now included in that definition as well. And so we are now obligated, and nobody that I am aware of was inspecting the farm stands. We're still working with inside the department on this issue, especially as we're going to tie it back into planning, because these also tie into issues where administrative use permits are required and the like. So I'll be working with George a little bit on this issue.
But this is similar to the large discussion we had on farmers markets. Wouldn't that?
I think that this is actually a little bit different. This is somebody that's going out on the side of the road. They're not selling as an example, if you grow strawberries and you sell them in front of your property or on your property, you can do that and it doesn't require a permit. Okay? You also can take those strawberries to the farmer's market and sell those strawberries at the farmer's market, and you fall under the purview of the permit for the market as a whole. This is somebody who's actually going out on the roadside or in a specific area and selling their strawberries, as an example. So they're not exempt because they're not selling it on their property. They're not falling under an existing permit for a farmer's market. They're actually their own facility. And again, I think there's a bigger issue here that I'll work with planning on too, who I didn't give fair warning to. But because when it comes to this kind of thing, we're also talking about land use issues and administrative use permits and the like. So essentially what you're seeing there is 1 hour's worth of activity for the inspector to go out, inspect it, issue them an annual permit.
Well, if they don't have a permit to exist,
then we wouldn't issue them a permit. If they can't get an AUP, as an example, from planning, and they're not allowed to set up on Tom's parcel, as an example, we would not issue them a permit either.
Let me try a few different versions of this and see, going from something that's obvious to something maybe more on the edge of this. If a kid has a lemonade stand, that's not a farm stand, correct?
No.
All right. And if you have a wheeled cart that has a particular product grown on the farm that you wheel out to the road and sell occasionally, that doesn't count.
And it's on your property, it certainly doesn't count.
All right. Well, let's say it's in the right-of-way where your property goes out to the middle of the road.
I would literally have to look at the definition of the health and safety, but I think there's a certain amount of common sense that we try and apply to these kinds of things. I do know that we're getting the time of year where it's not uncommon for people to be setting up and selling oranges or strawberries or cherries, and as a matter of fact, I've already seen some people out there doing
cherry stuff all up Highway 49 right now.
Yeah, exactly.
Are those not part of this farm stand, or are?
Those
are they in or out?
They would be, the ones that I've seen would be in. But my question before we would even go out there ourselves is to go to planning and say, do they even have a right to be there? And if so, then we would permit them to actually sell the produce.
Let me try a couple more.
Sure.
Let's say you're the cherry farmer, and you build a temporary stand like what you see on Highway 88 going down into Stockton.
Right.
You take it up for cherry season, and you take it down, dismantle it for other seasons. What is that in or out?
You may be moving into what we call a temporary food facility. My guess is if they're selling only cherries, I would say you're in.
Okay, if it's on the farm, you're growing it, and you have a temporary structure, that's
on your farm, you're out.
On your farm, you're out.
Okay, but if you well, that's what the Highway 88 stuff is. So let's get one more thing. You're on your own farm, and you build a permanent structure that's on your property that sells a variety of products year-round.
Are they grown all on your property?
Yes. I'm just giving you
You're in as a, no, excuse me, you're out.
Doing that.
You're out.
But you'll need a permit from the building for your structure.
No, you are out because you're selling it on the property in which you produced it.
All right, okay. That's through any kind of construction. The rest of it's with the building department.
Correct.
All right.
Correct.
Have you gotten any?
I would think what you will see is something like what Steve was saying. Somebody sets up for 3 months or 4 months. That makes sense. If you're setting up for a day, it doesn't make sense at all. You're better to take your product to the farmer's market or sell it on your property or what have you.
I mean, the way you're describing this application, you're probably going to run all those people out of Angels.
Yeah. Right, and that's the real underlying issue, is whether we desire this in our community or not. That's the real question. Do we want people from other places?
Wherever there's a wide spot in the road that people can pull over, they can set up a stand.
The other option...
If you have any permission from anybody, it may be partly in the right-of-way, maybe partly on some private ground, but, it's usually 2 people or 1 kid.
Right, I know. And again, pursuant to health and safety, this is something that has been passed, statutorily. This isn't something that, it's not a county policy or a department policy. I mean, if the board's concerned about a fee, I mean, we can still permit these people and not charge a fee.
Okay, so why don't we add it with the health and safety code and put 0?
Okay.
So then it's...
I mean, that's all you're going to be dealing with. If it turns out to be a problem, then bring it back to us.
Okay, that's
at least you have it, but it's...
You're talking mom and daughter.
I understand.
2 nights or 2 days on the weekends.
Yes, I understand.
Cherry season's pretty short to begin with, so...
Okay, do you want to go to temporary food facilities?
Yes, temporary food facilities, and this is for prepackaged foods only, that's selling candy bars and that kind of thing. We're actually halving the existing fee. We feel that we can do those inspections and issue those permits quicker than some of the larger facilities. There's not as much to check.
But it says new.
It's new because it's new because we're reducing it. It's an existing fee, but it's a reduced fee.
Okay, so you need to be clear. It's not a new fee. It's a revised, and it's going from whatever, $90 to $45.
Correct. That is correct.
I think we can muster support for that one.
And then finally, there's the enforcement activity hourly rate. That is a general fee. What we've done in the past is we've put these general fees, catch-all fees, if you will, at the end of each program. That gets to be troublesome because if we're looking at water wells versus food facilities versus hazardous materials and underground storage tanks, that kind of thing, what we want to do is just clean it up and keep our weighted rate as one. It's all one rated rate, but instead of going to 6 different places in our fee schedule, you just go to 1. And so that's a cleanup. It's an existing fee, but we're making it, we're consolidating it.
Okay, now the school is...
A school is...
I know it's a 0, but why is it on here?
That's also just been defined for us to inspect. So we've traditionally inspected schools, and we traditionally have not charged them. What has happened in the past is schools were exempt from being charged fees. Okay? And we could have, quite frankly, charged a fee, and unless they challenged it, they would have paid it. We chose not to do that. We've always done a courtesy inspection or 2 annually. But the bottom line is, at this point, we know what the budgets are and the like, even though we now have the authority to go in and inspect them and issue them a permit. We felt, at least for this first year, not to charge them and continue on with what we're doing.
So that is now under the health and safety, a new one?
It is. Right. Schools are included as being our authority to inspect under health and safety.
Okay, so you're going to put the authority which established it, right. But it's new, but there's no fee.
There's no fee, right.
I understand. Did we have it before?
No.
I'm not clear. Huh?
No.
Okay, so you're just for the record listing it?
We're listing it for the record.
And there is No fee, okay.
That's correct. And before, even though it wasn't listed, we did it as a courtesy only because the school districts would call us and ask for that inspection.
Got it.
And then finally, something else I do not believe is on your list here, something else that we're doing, is we want to prorate for food facilities. Annual fees, we want to reduce by 50% for those fees, food facilities operating on or after July 1. Okay, so that, what we're trying to do there, and I know it's not on your schedule, but again, this is kind of a break to the business community. If a person comes in and pays $250 for a food permit fee in September, and they turn around and we bill them again in January, that's a little bit tough. So what we're saying here is, if we were to take that $250 number, we would half that and say you're only going to pay half a fee because we're going to hit you again in January for the full fee for the full next year. So we're giving them a break. We're prorating them, and if anything comes in after 6 months, we're not charging them for a full year's permit.
Okay, but that's not on here. The rate's not changing. It's just an explanation.
It is.
Okay, thank you.
And I will make sure that I'll make sure that I give Shirley another copy of this.
Okay.
All right.
Now we have. I'm sorry, Steve. Do you want?
I want to make sure I'm reading this right. Under our column, it says under late fees, 50% of fee, but that's not really that's not what we're talking about there, or is that in addition to the 50% we're just talking about?
No, that
is the explanation.
50% of fee is like the question I asked. If they're late, the late fee is 50% of the $45.
Right.
Correct.
Or 50% of zero.
Correct.
So you take that out.
Which is not the same thing as what I was just talking about.
So yes, that's what I thought. So let me ask a question on that, since I several of these. I'm assuming that there's some nexus between the cost of processing something and the fee that we apply.
Absolutely.
On a late, it seems like collecting a late fee is not that complicated, and why would it be 50% of the original fee? How do you justify that?
What we tend to do is when we send out our bills, let's say for restaurants, or in this case food facilities, and they don't pay within the 30 days or 60 days, then we send out another notice.
Right, that can't take that much time, right?
And then we send them out another notice, and then sometimes we even send them out a third notice. So what's really happening there is we are taking a lot of time, staff time, and office time of sending out these notices. Quite frankly, if somebody doesn't pay right away, we will send out a second notice saying there's a 50% fine, but we'd like to see you get this in. So essentially, unfortunately, Steve, what we are doing is we're incurring a lot of cost, and generally it's only a fraction of the businesses. So that is why that 50%.
So it's the incentive for it.
Let me just say, okay, in an extreme situation, you got 3 letters you got to send. All right, but these are form letters, and what happens is you got to stuff an envelope, you got to put it through the mail, and somebody's got to sign it, right? That's the transaction.
That's part of the transaction.
All right, so we have 3 of those that might happen in an extreme situation, and for that you pay 50% of $267, which is $133.50.
Right, and your weighted rate is $89. You're also tracking this in what we call our Envision database. So there's a little bit more to it than just printing off a form letter and that kind of thing. You're tracking the front office staff. They're tracking what's coming through as the permits are coming through. When they pay, we issue the permit as well. There's another thing here that's not even considered, but it's a bigger issue in fact, and that is you must have a valid permit to operate a restaurant or a food facility. It is a violation of the Health and Safety Code, much bigger issue, to be operating without a permit. Okay? So the 50% fee encourages, obviously, people to get their fee in so we can get the permits out, so we can get out and do our inspections. But the Health and Safety Code is very clear. You do not operate a restaurant or food facility without a valid permit. So that does kind of tie into this conversation.
We've had a steady stream of people coming before this board saying things that I find usually pretty offensive. When people say, let's run as efficiently as the private sector, I think of looking at things like the banking industry and what happened to us all and say that's bosh. But when it comes time for late fees, even the most reviled credit card companies don't have anything quite this large. And I'm wondering, I'm looking at how the public perceives our efficiencies and whether we're within a certain range of common practice. And 50%, when I look at our other late fees in the county, seems that it's really out there.
I can tell you that 50% late fee schedule has been on the environmental health schedule probably for the last 8 to 10 years. It has not really been an issue, quite honestly. And again, you have to understand there are not that many players out there who don't really follow through. And this includes, by the way, we do call the food facilities as well a lot of times and tell them, or we send an inspector out and we'll say, listen, we'd like you to get in within the next week. That kind of thing to encourage people to come into compliance. Because again, my concern is that they're operating with a valid food facility permit, and it should be a concern for them too. Because the last thing anybody needs is to own a restaurant, somebody gets sick, they come down to our department and they say we want to see the file, and they see they don't have a valid permit. That's a problem. So we're trying to protect them as much as anybody.
Did you want to make a change in that or recommend a change?
Well, there seems to be not a lot of flexibility in this regard. I was looking for some other ground, but at this point I'll just vote opposed.
You can make a recommendation.
50% too. I think that's awfully steep just for being late, unless you're being reasonable in how you apply it.
I will tell you we don't commonly apply it. I'll be very honest with you.
Yeah.
I mean, we use it as a means to say, please, get your payments in so we can issue your permits so we can do your inspections.
Okay, so what we're doing is talking about two right here, because one's 50% of zero, so
that
doesn't apply. Would you like to make a recommendation to reduce that amount, Supervisor?
I would, well, let's see how people feel. I'd propose 25%.
I support that.
So do I.
Okay. Fee, now it's the same. The late is 25%.
On those two fees.
Correct. If there are others, Brian, because we're not looking at them, you might reduce those to 25 too.
It's consistent.
If it becomes an issue,
okay,
then you can come back to the board.
Okay. It's been consistent. It is, if anything, the environmental health fee schedule is very consistent. So yes, everything has been set at 50% for many, many years.
Right. I think we're just trying to look at what people have, what their exposure is given the times.
Right, I understand.
Thank you.
And again, one of the reasons why we're trying to reduce some numbers as well. So is the board directing me to reduce these all to 25% late fees?
Yes.
Okay.
Yes.
Late fees 25%.
Yes.
Okay. All right.
And be judicious when you apply it. I mean, if somebody's just having a hard time, but finally the check came in and they can pay you, I mean, the idea here is to keep people in business, not to put them out.
We agree.
That's what I heard him say.
Trying to shed the sheriff of Nottingham image here.
Yeah. And quite frankly, really, we don't really get complaints, so it's been working. So,
Madam Chair, I have one question of Mr. Moss. May I proceed?
Yeah.
Okay. Brian, you said a moment ago that this licensed healthcare facility fee is something new.
Yes.
And you went on to say that you would inspect a facility like this at least once a year.
At least.
What I'm concerned about is if you went out and inspected them in January and then happened to drive by again and inspect them in March or April, did you charge them $267 twice?
No.
Okay.
No, absolutely not. And that's the other thing and that's a great point. Thank you for bringing that, because understanding all these fees, understand that some facilities take several inspections while others take one inspection. And so that is very true, and it's not even uncommon for us to go up. If somebody says, I'm going to open a restaurant, and if I have an inspector that's going by, and that's their district, it's not uncommon for us. We don't do this all the time, but it's not uncommon for us to swing by and say, look at it and say, yes, these are the things that you would need to do, because people will ask about flooring and that kind of thing. So we try and be as helpful as we can to the Big Bay community.
Okay, and then another question, just while you're here. I became aware about 2 months ago about an inconsistency between the county standards and the state standards on it's like a mobile food dispensing facility. I'm talking about the Cruiser's ice cream folks.
Yes.
You may be intimately familiar with this, but I was shocked to it when I heard that had they had this facility built to comply with the state standards, they wouldn't have been in compliance with the county standards, and therefore they conceivably could have wasted thousands of dollars. They would have been out of compliance with the county standards. So my suggestion to you, it has nothing to do with this fee thing, but would you do me a favor and call them up and try to find out specifically what they're talking about, so that we attempt to make sure that because they had to get 2 inspections, state and the county, it's inconceivable to me that they would be inconsistent in their requirements.
And you're absolutely correct, and that is the reason the state's involved in the first place. So I'd have to look into that, because that's inconsistent with what the whole purpose of the state putting a seal on that mobile food unit is in the first place, because it is to dissuade what was happening at one time. A mobile food unit would go into Tuolumne County, and they'd make requirements, and they'd come into Calaveras, and we'd make requirements and that kind of thing, depending on how we all interpreted the code. Quite frankly, we've all been very consistent among ourselves in the mountain counties. But when you're talking about the LA Basin, and somebody says, well, you don't have a Hep B shot, certainly in Calaveras County, we don't oversee that when it comes to food facilities. But if an inspector down in Southern California wants to do that, that's the kind of thing that was happening one time, and that is the whole purpose of that state permit and seal that you're talking about. So very interesting that's inconsistent, because that's designed to make sure that it remains consistent from one jurisdiction to another.
Okay, so please follow.
Thank you.
Yeah.
Yes.
Thank you. Let's do the library. Jeannie, did you want to?
Yeah, I don't have any information on this other than what's printed here. Shirley, do you have any other information in their written material?
But he was working with the department heads and putting a schedule together.
I'm sorry, I don't have any other information on that.
Didn't we raised it? We didn't have a fee before, and we raised it to $2.
It was set at $2 on last October, and the county librarian is asking to increase that by 50 cents.
I'd like to keep it at 2.
That's fine. Keep it at 2.
Steve?
I'm okay with keeping it at 2.
Ross? Okay. Then health, probation, treasurer. Okay. Now, we will go to the building department. And just before we go, Jeff, I'd like to take just 3 minutes. No, that's fine.
A lot of other departments use Permits Plus. We would not try to, the idea to get other departments to help on that maintenance fee doesn't seem feasible. However, the idea of a 1% charge on the use of Permits Plus for issuing permits would allow some recuperation of the fees for the maintenance. And based on the last year, we could probably have recovered somewhere around $7,000 to help offset that $20,000 bill every year for a 1% charge on permits.
Jeff, why wouldn't this be under like an A87 cost or something out of, if other departments are using it, and 1% of a permit fee can vary depending on what you're submitting for your permit, but the permits plus is, I guess what I'm asking is why that versus a flat amount of $10 or $20 or...
that was a place for us to try to start to establish some sort of a way to recover the fees that we're not getting for the maintenance cost of Permits Plus. Certainly, I would imagine there's other options out there, but we have nothing in place currently. So the idea was to propose a 1% on the permit fees for the use as a user fee to generate some recovery.
But I'd like to point out to you that if you're trying to create a revenue source to obtain $20,000 and you're charging 1%, that's only $2 million worth of fees. Your fee structure annually, and I mean, granted we're down, but you're collecting far more than $2 million worth of fees annually, aren't you?
We're currently collecting about $700,000.
$700,000, okay.
So 1% of that gets you around $7,000.
Oh,